Hello everyone, Dr. Sam Schroetke here at Physical Therapy and Hand Clinic of Hillsborough with Technique Tuesday, Christmas edition. And we're focusing on headaches because I know for a lot of us we get headaches at this time of year. Even though we love being with family, we still might get a headache. So I'm showing you a series of exercises that work for cervical headaches. So those are headaches that often originate in the neck or the base of the skull, and then they work their way into your head. They tend to be one-sided or unilateral. I talked about the ram's horn where it comes up and around. You might feel it behind the eye and the maxilla or upper lip area or the jaw. Any of those places are fair game for a neck headache. And they tend to be provoked with certain like movements of the neck or sustained positioning. And what tends to be most effective for treating them is a sustained position. In two previous videos, I've done sustained retraction. If that one works, you do that one. I did also sustained flexion. If that one works, that's the one you do. Don't do anything else. If you've tried both of those and neither of those have worked, here's a variation. So this is going to be cervical retraction with flexion. All right. So this is one where I might use a lumbar. It's always good to sit with your back all the way back in the chair. Okay, so what we're going to do on this one is retract first, and then from there, you're going to flex. So you're getting flexion on these upper joints, which tend to be the upper neck joints, and those tend to be the joints involved with a headache, C1, C2-ish, sometimes C3. So we're going to do a retraction, and then from there, little flexion, and their hands are going to help hold us there. I would try it first for 30 to 45 seconds to make sure that it's not going to flare you up. And if it doesn't, then you want to try to get it, you want to work up to 2 to 3 minutes, okay? I'll show it from this angle too. So retraction, that's this one, pie in the face, or ugly person coming in to kiss you, whoa. So retraction, and then a little flexion, and overpressure with these hands. 30 to 45 seconds. When I'm doing the overpressure with my hands, I'm interlacing my fingers, and I'm putting my hands on the lower part of my skull, upper part of my neck, because those are kind of the joints involved. It just gets a little more focus to that area. Okay? So one more time, retraction with flexion and overpressure. So let's say I did 2 to 3 minutes, which is what I want you to try to do. Your headache either is totally gone, it feels better, and better can mean less pain overall, or it's a smaller area of pain, or occasionally you felt better while you were doing it, and then when you let go it kind of feels a little worse or back to normal. That's not necessarily a bad sign. I would be doing this 3 to 4 times a day, so holding it for 2 to 3 minutes, 3 to 4 times a day, and whenever you have a headache. Give it a try for 1 to 3 days, and if you're getting better, you'll know, right? Because you'll either have less headaches or less intense headaches, okay? Or no headaches. That can happen. These can resolve quickly. One more time, retraction. And when I'm doing this flexion, it's upper cervical, so I'm retracting, and then that's all I can do because it's just focused on these little joints. So it's just a little bit of flexion. Retraction, flexion, overpressure. 2 to 3 minutes. Retraction, flexion, overpressure. And I'm not pulling hard. I'm just adding a little bit of force to get me farther into that flexion. All right. So, as with any technique or exercise, talk with your physical therapist or physician before doing them to make sure that it is appropriate for you. I'm Dr. Sam Schroetke here with Physical Therapy and Hand Clinic of Hillsborough with our headache and Christmas edition. Any questions, leave it in the comments below. We will get back to you. Like us on Facebook, like the video, and all right, thank you.